morning, afternoon, good evening, depending on where you are in the world. And a very warm welcome to the United Nations University International Institute for Global Health webinar series, which is this one in particular is a conversations in the Global South about the COVID-19 pandemic. My name is Pascal Alate. I'm the director here. It would have been lovely to have you here in Kuala Lumpur, and hopefully that can happen soon. Today's call is in webinar format, which means it's a one-way camera engagement, so you will only see the panelists and not others on the call. Participants can engage via the chat function, but if you want to ask questions specifically to our distinguished guest, Amaya, please put your questions in the Q&A function. This will be moderated and we'll need to pick up the questions from here, specifically from the Q&A section. The webinar will be recorded and will be shared along with the slides, so they will be accessible afterwards. Now, just a little bit about this particular webinar series. It's an initiative aimed at highlighting and reflecting on the experience of low and middle income countries and how they're tackling the COVID-19 pandemic. Specifically drawing attention to strategies and interventions that have worked or failed to work. And of course, we can't do it without looking at the gender dimensions of the ongoing responses. A previous one has, we had the African Centers for Diseases Control, the Africa CDC, to discuss how the African Union has taken the lead in a continental response for this. Today we have Dr. Amaya Gillespie, who will discuss the gender and socioeconomic impacts and opportunities of COVID-19 in the Middle East region, the MENA region. And the talk will specifically highlight the gender dimensions of community engagement and risk perceptions around COVID-19. We'll look at leveraging lessons health emergencies to tackle that have been used to tackle COVID-19 related to gender issues, and applying a gender perspective on opportunity strategies and practices for COVID-19 national responses. Just a few words about Amaya, because her CV is absolutely too long and I don't want to take up too much time. Primarily, we are absolutely delighted and honored that Amaya has accepted a position with us as a Principal Visiting Fellow of UNU-IIGH. She is a public health expert and senior leader in the United Nations system, where she's championed the rights of women and children as part of her work with organizations like WHO, UNICEF, and UNAIDS. Her grounding in public health and behavioral sciences has been the common thread throughout her career, and she has an amazing reputation as a social justice advocate and as a leader in complex emergencies and pandemics. And she was very heavily involved in the efforts in HIV, in Ebola, Zika, and now COVID-19. Amaya is currently leading coordination of the COVID-19 response for the Middle Eastern region in a joint role with WHO and UNICEF, and will be bringing that experience, but is very much with us as one of our own, as a visiting fellow. The conversation will be moderated by one of our amazing fellows, UNU-IIGH as well. Dr. Claudia Abreu Lopez is a research fellow at UNU-IIGH. She spent 20 years in academia with positions at the Faculty of Psychology at the University of Coimbra in Portugal, the Institute of Social Psychology at the London School of Economics and Political Sciences, LSE, and the Department of Politics and International Studies at the University of Cambridge. Prior to joining UNU, she was an affiliated lecturer in statistics and methods at Cambridge and a lead consultant in big data and gender at UN Women. Claudia has also worked in the charity sector with Girl Effect as a data scientist and Africa Voices Foundation as the head of research and innovation, leading projects that use digital data to accelerate and evaluate the impact of public health interventions. She was also involved in evaluations of the World Bank, BBC Media Action, and GPSDD. I will hand over the floor now to Claudia and to Amaya. I hope you enjoy the session. If you're not able to stay, can you please stay with us on the website to be able to download it afterwards. Claudia, Amaya, the floor is yours.
Thank you very much, Pascal, for these very kind introductions. And we are delighted to have you, Amaya, for these conversations in the Global South about the impact of COVID, mainly in the MENA region. And maybe we can start by discussing the question of what have you learned from previous pandemics. So you have this vast experience working through Ebola and Zika on community engagement. So what do we know at the moment? Is there a global strategy, or is every country doing something different related to COVID-19?
Thank you, Claudia, and thank you very much to all of you at UNU for the opportunity to have this conversation today. And yes, in regards to your question about is there really what sort of strategy is there? There are strategies at every level, actually. And it's been very interesting to see how this management of the pandemic, if you like, this strategy has differed a little, improved a lot from the way that we've managed others. And of course, we're learning as we go, and that is what's important. A couple of things that are different. I think around the world, people are seeing WHO at the global level. They're seeing the press conferences. They're very frequent. It's a single voice. You know, these people become familiar. In your own country, I think a lot of people are seeing the same voice again, authoritative voices. Often it's the chief health officer, for example, but it's a consistency. That might seem like a simple thing, but it's a really important thing that we have learnt from previous efforts. One is to communicate consistently. In the past, we didn't communicated badly, or communicated about the wrong things. So we're really learning, and a lot of what I'll talk about today is about how we're communicating. It's not everything in terms of behavior change, but it's definitely something very important. So we are seeing much more attention paid to that credible voice, despite what you may be feeling when you're looking at social media and watching the news, and they're telling you about all sorts of misinformation and people not trusting things. Globally, what is stunning to me as a behavioural scientist is just how much cooperation we're getting from communities. It's definitely not easy, and it's going over a very long period of time. So there's a few things that are different, and I'll get into more of these, but definitely the fact that this is a long-term problem, it's happening to everyone at the same time. There is no safe haven. For women, these things are actually very, very important. And also the idea of actually having access to information much more than people had in the past. For women, this makes a big difference as an example of a group that's generally vulnerable. So I'll pause there.
Thank you, Amaya. Maybe you want to start your presentation, and then I think the audience may feel free to pose their questions in the chat, and then we can maybe ask questions when it's relevant to what you are presenting.
Sure. So I'm hoping that you get to see my screen. Yeah, how's that looking?
Yeah, looks good.
Great. Okay. So this quote is from Antonio Guterres from the United Nations, head of the United Nations, as you may know. And this was a statement he made very early in the pandemic. And unfortunately, it's becoming more and more true as we go on. But the point of us talking today is to identify the things that we can do that will help to slow down the reversal, because it is a reversal. We shouldn't shy away from that. Unfortunately, there are no great options for us, and that's what's tough about this. None of these are like just going to be great at the end of it. They're all very, very difficult options. And of course, that's what's difficult about keeping people and bringing people with you in terms of leadership. Now, your question at the top too, Claudia, about what's different. And here's a couple of things I think are very important. The immediacy for women in the South. And at the moment, you know, I'm exposed to the Middle East and North Africa region, but I'm also working with colleagues in other regions, and I've also had experience in other regions too. So having a sense of that and getting information from others, and that's very much the place I'm coming from today, is to sort of give you an aggregation, if you like, of the sort of information that I'm getting as someone working in the response. Maybe none of it will be true for an individual, but I think some of it will be true for some of us. So I think that's where getting people's comments is important, and seeing how it adapts or feels different where you are. And that's certainly the key to this, to the whole approach, actually. So the immediacy of this and the long-term nature of this pandemic is very, very important, because at the beginning, we thought it would be just short term, and we came in with, you know, pretty blanket approaches, big national messages, just do this, know this, do this, and it'll be over soon. Now that we're at the stage where everybody's realizing it's not going to be over soon, it's a long-term effort, it's very, very important that we shift our strategies. Now, this is not to criticize the earlier strategies, because in fact, that is what we needed to do. We needed to do a lot of things quickly, short, sharp, brief, from consistent messages to people, policies in place, etc., and to move quickly, something that the entire world has done. But the real key here is for people, if in the global South in particular, if they don't go out of their house today, they don't work today, they don't eat tonight. Now that's different to even, you know, and I'm talking definitely for low income, it's even different in degree to middle income, and different by degree to high income. Everybody's worried about the same things, but the degree of concern and the lived experience is really something else. The immediacy for women in particular is something of great concern. And this is where we have there's all sorts of language that's emerging here too, which may or may not be helpful, but the idea of twindemics, you know, more than one thing happening at once. Yes, it's about COVID, but it's also about underlying issues, and we need to actually address both in order for women in particular and other vulnerable groups to come out in better shape. So in general, women earn less and save less. They are more in the informal economy, you know, much more, and they have less legal and social protections. They're much more unpaid work, definitely caring, not just for children, but in terms of the pandemic, that's become much more obvious. And because of that care economy and the unpaid work they do, they're often forced to drop out of the labour force, but also, of course, they are more likely to be in flexible work, which is lower paid, and so the cycle continues. And of course, single parent households is also true for women to be more the majority. So in general, they have less capacity to absorb these economic shocks. So when we think about what's different this time for women, you know, you could say, well, nothing's different. It's all the same things. It's the same things. Before COVID, you know, before CNN, during CNN, after CNN, it's the same things. But I do believe that there are also things that are significant about this. So this slide is really, I'm trying to bring together a lot of information that has come from the data that we have that's out there right now. It's true that in the area of behaviour, and particularly community engagement, there is less hard evidence, randomised controlled trials that come out with, the impact of having community engagement versus not is X or Y. There's not so much of that type of evidence. But actually, with each of these pandemics or epidemics within countries, we are actually getting some better data. Some very good work done by UNICEF, WHO, and a group called Anthropologica, who are anthropologists and social scientists, looked at data that was specific to the Middle East, but also looked at how it compares in terms of global information too. There's a lot in common, but there are some things that are really quite interesting. And I guess I'd like to use some of those examples just to show how some of the common core concepts, how they can look at the local level. For the whole strategy, whether it's global, regional, national, subnational, the issue is about trust. Now, without trust, we can almost do nothing. This, as with many of the other big global challenges we've had with Ebola, for example, with Zika, with SARS even, and MERS, with this pandemic, there is no cure. There are treatments, but there isn't a vaccine yet. There is unlikely to be a vaccine available to the public very soon. When a vaccine is available, there'll be some challenges about that, and there may well be vaccines that are effective enough to be released. These will go first to health workers, and this is a good thing. But we're going to come up against a lot of challenges around that, and when that starts happening, when we're talking about vaccines, but they're actually not available to the public yet. This is going to be a very complicated time for us, and will certainly undermine some of the trust that we have even built so far. But all that to say, everything we do is about building the trust of community. Now, risk, there's a lot of talk within the strategies, and it occupies quite some space around risk perception. We tend to overuse the idea of fear. Fear is useful for getting attention, but without showing people what to do, it actually can cause inaction. Uncertainty undermines trust, and we've seen that in this pandemic, changing our minds, people say, when actually it's just we've been learning and as we go. But I've included here this idea of disgust. Apparently, when we're disgusted by something, we might be more likely to stay with it when we can see what we can do to not be disgusting ourselves. And for example, hand washing. We found that in a number of regions, people will do hand washing or will be seen to do hand washing just because they want to be regarded as somebody who does engage in healthy behaviours and hygienic behaviours. Not necessarily for the reasons that we would want as public health experts. Showing in some of the campaigns and some of the ads we see on TV, showing what germs, showing where it goes from hands to mouth, showing all of that, can help to motivate people as long as we show them what to do. Hope, pride, the idea of resilience, these positive emotions are things that are actually much more important at this stage in the pandemic as well. For women, because they tend to have lower literacy and lower access to information, we do find that some of their knowledge, their information is more confused and more uncertain. So we do tend to see that women may be a little more concerned, a bit more worried, and have, I guess, a higher risk perception, meaning that they see things as being more serious than perhaps a male counterpart. This is a very big generalization, and I'll modify that a little in the next slide. But in general, on social influence, we want to belong. We want to participate in traditions, and in the Middle East, there are really big traditions that also overlap with the idea of social influence, but also religion. Everything from handshaking. The Middle East are big huggers, you know, kisses several times, handshaking, etc. We found that actually religious leaders, they have very strong social influence, of course, they have been very willing to look at different ways of doing things and compromise. Again, contrary to contrary to popular belief, perhaps. So seeing these issues as both enabling factors, as well as sometimes being barriers, and looking at the ways that we can use influencers, you know, in an enabling way, but making sure that they are representative of the groups that we want to work with. Because often the strongest influences in these traditional societies are not so representative of women in particular, but also other groups, other vulnerable groups like migrants, etc. The use of face coverings in this region by women would be, you know, you'd expect would be largely protective. And we do see that women in this region are less likely to develop COVID. There are more men there are more men in the caseload, and men, of course, globally tend to die more often, maybe because they arrive later in the development of the disease, etc. But the thing about face coverings is, in terms of the very traditional face coverings of women in the region, they, of course, wear them out and about, which is good. But when they're together, when women are together, they're more likely not to have those face coverings. So there is a risk there that that perhaps, you know, one wouldn't expect. And we've learnt this from looking at the research. Ultimately, the structural issues are very important to women, because this is what women do spend a lot of their time doing, is compensating for the lack of structure in their society, and you know, things like I mentioned before, the unpaid sector, etc. One of the big things is access to cash. For women to have access to cash now, you know, not later on when we're recovering, you know, with all sorts of economic strategies. Access to water, obviously, even with the strongest intent, which a lot of women have to do the right thing, they're unable to because they don't have the facilities, or maybe they need to go out to work every day, so they can't stay home. I will just move forward to the next slide, because I want to show you a different type of information, a different way of looking at research as well. And I think all of these issues are things that that we're all very much familiar with in terms of the barriers for women.
As you're talking, I was also thinking that something that the COVID-19 shows us is that it's possible to challenge social norms and adopt a new normal. So all the examples that you're giving about how people relate with others in terms of kissing, hugging, and staying in groups, we were able to change it in a matter of weeks. And this is something that other public health interventions have met with resistance from the community. So it seems that we are doing something well at this point that I take your word that is related with the consistency of communication, and maybe because it's more globalized and people have more access to information through the digital world. And it seems that is something that it's very striking at this point, that we have learned as social scientists and behavioral scientists that we know how to change behavior, so we can take that for the future. And so, yes, I have one question here. Yes. I don't know if you want to answer. Is like, so what are the lessons coming out from working with actors who may not have engaged as closely with the health sector prior to the pandemic? And who else do we need with to create research and solutions creating relationships? Or who else do we need to create relationships to for research and more coordinated actions as a collective?
Sure. So just briefly, and then I will come to this a little later when we're talking about solutions. I want to say a couple more things about what we know about the problem we're trying to solve. One thing we know is that in terms of, we know that community engagement is important, but because of the restrictions on movement in particular and social interaction, it's been harder to do. Now, at the same time, in the region I've been working in, there's very good digital access. So we've actually had more exposure to that and learning to do that better and differently. So that's an absolute plus, including, for example, in education, flexible education through technology. Of course, there's challenges, but still a lot more people are getting much better access and much more clever technology and useful technology during the pandemic. But because of the economy is sinking, we do not see the engagement in the private sector, because everyone, the whole world, is in it at the same time. There's a little more protectionism, which you've seen in the headlines, politically, I mean, protectionism. So because my country is suffering, even though I'm a rich country, I might have less attention than I normally have and historically have to countries that are in a much worse situation. So there are some big differences at that macro level in terms of what's available to us to use at the local level. Having said that, there's been enormous generosity in terms of, there are hundreds of millions of dollars going into low-income countries. There's also, in a region like the Middle East, where you have the highest income countries with the lowest income countries, conflict, natural disasters, etc., at the same time, very complex. We are seeing more support coming from within a region, and that we've seen. Now, that's not specific to the pandemic, it's a trend that's been happening for some time, but it's an important one. But I will come back to that. I just wanted to talk about data in a little bit different way, because we're used to sort of descriptives and looking at indicators and variables and knowledge, attitudes, practices, and having a look at it and then saying, oh, this is where we need to focus, even at sort of sub-population levels, which is great. We need more of that, particularly the behavioural data. But this slide here is from some research done with a group called Kantar in 58 countries. And it's successive waves, more like polls, I'd say, a bit like the way they do political polls. But successive waves, so you can see changes in information over weeks, not months or years, yeah, which is much faster than your average sort of social science case control study. So it's helpful, but as a poll, it's selective, it has challenges, of course. What's different about this is, rather than just looking at all the variables and disaggregating by men, by sex, men, women, boys, girls, age groups, different ages, perhaps where they live, etc. What they've done is combined a number of groups of different types of variables to come up with what we call psychodemographics. So it's a type. Now, what's interesting here, the big picture takeaway is that women are not one group, which is why I was hesitating about making generalizations early on. There are women in each of these groups, and I'll talk a little bit about what they are. The first two groups, that they've been called ostriches, they've got their head in the sand, don't know what the fuss is about, not really sure perhaps that it's real, and they don't care about it. The que seras, whatever will be, will be. These are people who are like, I don't have control, whatever, and I think it's excessive. The rules are excessive. Those first two groups, they are unlikely to be complying so much. They're not that motivated. They don't see a risk in terms of that risk perception, right? There are women in both of those groups, right? The next two, the hibernators and the good citizens. The hibernators, they accept the situation, but they don't need to be updated and seeing it all the time. It's all just a bit much, right? The good citizens in green, They want to be informed and they think that everyone should follow the rules. Those two groups, the blue and green, they are going to work with you. That's a third of the population. The first two is a third of the population as well. So this is 2/3 of the population. When you look at the last two, the distressed dreamers and the precarious warriors, distressed dreamers are really a little bit like, you know, they're worried. They're really concerned about what's happening. They're concerned about not just COVID though, they're concerned about life. So for me to continue to give them messages just about COVID is going to drive them a bit nutty and may push them down even into que seras or even ostriches, because they're so worried about perhaps they've got an underlying health condition and they can't go to a clinic or don't want to for fear, and their financial situation, lost their job, etc. Or their children aren't going to school. And we know that if girls drop out of school, it's really hard to get them back into school, much harder than it is for boys. I also want to make sure here, I'm not saying it's easy for anyone. It is not going to be easy for boys to get back into school either. It's going to be very, very challenging. The precarious warriors, these are the ones who are really frightened. And in the way that I was talking about fear before, that when you're so fearful, it can actually move you a little bit beyond what the best strategy is. They want the government to do more, so they might want to close the borders and keep it that way. They might be super protectionist. But in general, these two, the purple and the blue, are going to work with you, but you're going to need to keep reassuring them, and you're going to do more. You need to do more than just COVID. You're going to need to look at social protections and other protections, economic protections as well, to support them. So in terms of women, an important point here is women are not one homogeneous group. They are in all of these groups. So, some women tend to be a little bit less informed than men, as I said before. There's some suggestion that young girls and young boys may have different access to social media. Through this pandemic, we're seeing that young people are actually using it a lot. So it's not clear whether that is changing at the moment. Women do tend to worry a little more than men do, as I mentioned before. They tend to follow the rules a little more, and they tend to trust certain groups. And in actual fact, in the Middle East and other regions, we're actually seeing quite strong credibility in government, as I mentioned earlier, and probably because of that consistency and using very credible sources of information, which is really important. So I just want to show, related to this idea of typologies and psychodemographics, your reaction is different, like what you do for them is different. This squiggly line is a way of, so at the bottom, you've got they're multiple data points, and you can see how people's sentiment has changed. So just looking at the green and the purple, they're the ostriches. This is how they were feeling about lockdowns. In the beginning, they're like, okay, a bit supportive, and then they're like, no, I don't like it. Then as the lockdown is reduced in their country, they feel a little bit better about how things are going. The good citizens are feeling opposite to the ostriches, right? So it means that there's not one strategy. We need multiple strategies to address multiple sentiments at the same time, at the same point in time. People do not stay feeling the same. And that's something that all of us have definitely experienced. And we really do need to change what we're doing and listen to community and respond to their needs. So just a couple of points then in general about what we know and things that we do need to keep in mind and address, is that we know that when there's increased instability, like more unemployment, people tend to revert to traditional gender roles. Tends to be not good for women and girls. FGM, these sorts of harmful traditional practices become a concern again, forced marriages, etc. But lots of other implications as well. Governments tend to divert the funds towards this emergency in front of us, but that tends to mean it goes away from social services and benefits. That hits women harder. And also, when we do see ourselves coming out of a pandemic, and these are some lessons from Ebola in particular, we see that men's economic activity, their jobs rebound. The type of jobs they have come back. They're more permanent than the types of jobs and industries that women work in. All of these affect the way that we might respond. So this, just in general, again, this is the stuff we know. It's not so different for a pandemic, and yet it's harder, and there are distinctions that we need to work on during a pandemic. As paid work decreases, unpaid work increases for women, the caring factor in particular, the reallocation of resources, the impact on general health, like maternal child health, fertility, pregnancy, teen pregnancy is something we saw increase during Ebola, for example. Girls not in school, they become exposed to a whole lot of other things. And the idea that these secondary impacts, like unemployment, poverty, etc., health status, these last. They're not temporary. So, Claudia, I just want to pause here because I'm going into now looking at some of the solutions. And I also was hoping that Vitya, who's helping us with the back end here, might be able to bring in a voice from the field, the real local level voice. I have a colleague, Mamta, who is someone I've come to know through an organisation called ConnectAid, and they've been very active in trying to connect people with causes, if you like, and particularly at the civil society level, where we know that's where women are, and that this is a strength of women to really do things on the ground that matter. So I wanted to bring in this very short piece where my colleague Gail from ConnectAid is talking to Mamta, who's in India, who works with an organisation known as FXB, and just talking just a little about what it's been like for a civil society organisation working on the ground. Over to you, Vitya.
And again, I would say it is the FXB sense of passion and commitment. We said we are going to get into relief because where we work, our community cannot stay hungry. Our children cannot stay hungry. We're not a relief organization, but we jumped into it. And I'm so proud. When I sat with my team and we were discussing, and we had no funds, we didn't know anything. We had zero funds, Gail. And today we have served 15,000 plus families with relief, 4,000 plus children with infant food and nutrition food, and more than 8,000 families across the country reached out to them with prevention messages. So I don't think that we were all.
Great, thanks. We just showed a snippet of just to sort of ground the conversation a little more. And maybe, Claudia, we want to just pause here, and there seems like a lot of conversation going on.
Yes, so thank you, Amaya, for all these insights so far. And it sparked really very interesting questions that we have in our Q&A chat. So one of the questions has to do with what you're talking about social norms. So they don't always go in the positive direction. There are social norms related with false assumptions about wearing masks. And we have someone from Malaysia to say that in Malaysia, wearing masks, especially in social gatherings, are often considered to be socially uncomfortable. And there is this assumption that people wearing masks are considered shameful and a sign of weakness and being over-conscientious. So have you found any other examples in your research about such resistance to the norms or bringing up a new norm? And what steps do you think can be taken to control this stigma of the anti-masks groups?
So one of the big lessons for us, learnt many times over in many different situations, is that it's not logical, right? A lot of these decisions are not based on science. They're based on our fears, belonging, They are based on social norms as we have known them. They're based on emotional aspects of, protecting my family, whether I send my daughter to school or not, etc. So with something like masks, traditionally what we have done, and it felt like a misstep in the beginning, the way we talked about it, and I mean we globally, people with credibility, the reasons they had for not suggesting to go out wearing masks was actually a complex supply chain reason. We didn't think we had enough. Now, a different way of doing that, and this is about about leadership through these sort of crises, it's not helpful to use an authoritarian type leadership to say, this is the right way, this is the wrong way, do this, don't ever do that. It's unhelpful in a crisis. It's better to use empathy around, I know what you're going through, we know this is hard. It's even better if you can address some of the underlying things. Like I said before, it's hard for me to think about COVID being a risk if I'm in a domestic violence situation. And it is true that around the world, we see increased domestic violence at the moment, apparently where people are locked down together and don't have great conditions for that quarantine or isolation. So the idea of the stigma from masks, it does come a little from those missteps at the beginning. It also comes because we were talking about science. There was a whole discussion about it works, it doesn't work, it's for this, it's for that. The shift that's happening in relation to masks, where it's working well, is more of an emotional one, more appealing to community values and collectivism. And by that I mean promoting the idea that when you wear a mask, it's actually most protective for the people around you. So for older people, you might be shielding. And in many of our regions, and where the low-income countries are and in the South, older people do have status. So the idea of protecting them is an important one. So it's appealing to the good-natured part of the good citizen, of all citizens, that seems to be the way that people can hear what you're talking about rather than want to argue with you around that's true or that's not true. So is that helpful, Claudia? Do you think that addresses it?
Yes, I think it answered the question very clearly. Yeah. Thank you. We have also the question related with the COVID tribe. So how best to listen to the sentiments of the communities, particularly segmenting by these tribes. And the related question that is, so we need multiple strategies to address these multiple sentiments. So can you reflect in one or two examples of this more target communication or more selective or targeted listening to communities?
Yes, so one thing that is, that again has been learned from previous pandemics, and particularly from Ebola, is the idea of community listening, or listening to what's happening. And that's being done using some of the social media and digital techniques that have been used against us for marketing and to make us buy more stuff. It's trying to use that actually in a positive way. So most countries that I'm aware of have some form of what they call social listening, where you're scanning what are the conversations about, who's tweeting, what are they tweeting about, what are the key words coming up in various digital platforms, whether it's TikTok or Instagram or whatever it is where you are. And it can be quite different in different regions. Some platforms don't exist in other regions or in certain countries. So it can be very specific to where you are. The really intriguing thing is that information and travels so fast in communities. It's actually part of the problem we're having, but the right information that we want to get across sometimes has a harder time getting around. And when we see who listens to who, there's never one person. It's multiple influences, and we need to be really clear when we're segmenting our sort of subgroups in terms of who we want to reach. We need to first have really good data to know what are they thinking, what are they talking about. So it's less about what facts do they know, Because right now we know that most of the world, the knowledge of COVID and what to do, blah, 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 is really high, really high. But we also know from behavioural science that does not automatically convert because of structural issues, etc., lots of reasons, but especially because of people's attitudes and because of what seems normal. So, you know, many of these questions sort of collide here, but when you know more about what people are feeling, right, not so much what they know, but it's important, you know, they're necessary, but it's not sufficient. What are they feeling, and what is it that they're able to do? And this is where I did want to just switch here to, I don't know if I can switch to my screen again, can I? To just perhaps, oh yeah, you can see that, yeah. Let's see, I wanted to switch
Go to the slideshow.
Yeah, I'm just going to make sure I got the right one. Tell me if you can see it. Yeah. So just hide that for a sec. In terms of some of the things that, in terms of solutions, because that's really what people are talking about now, there's no magic. There's no single thing we can do. We do need to do a number of things. But if there is one thing to say, what we need to do is localize our response. This is where women really shine. That's their strength. At a systems level, though, to get that to happen, we need more women in the response. We know that women are much more likely to be the frontline workers in health and other industries as well. But in terms of this pandemic, they're on the front line, but they're not necessarily at the decision-making table. We need a lot more women in those places. We know that that brings diversity and creativity. We know that women are already used to managing multiple things at the same time. And when you think about this pandemic, just how you've managed it yourself, whether you're male or female, when you think about who is tweeting each other and saying, how are you managing childcare? What do you think is going to happen with schools? Do you think that's the dads, you know, tweeting each other, or is it the mums? You know, what we know is it's mainly the mums who are already looking at ways of managing it in a local way. It's not to say dads aren't doing it. Of course, there are many dads involved doing it, but in general, it is something that women have done. You know, that women that have actually been responsible for too. So having them in the boardroom as well as on the front lines is what's missing. And it's not about one woman. We need groups of women in order to influence. We know that is actually true. It's not enough to have a token woman. They still don't get listened to. We need systemic processes too, like a gender impact assessment, not just of the situation, but also of the response. Like, what is the impact of lockdown on women? You know, that needs to be there. The idea of innovation, we need genuine innovation. And, you know, we're not really seeing that. We're seeing us using the old clunky systems to try to do something while COVID is around. But there have been some good things, you know, the telehealth. And again, it's not for everybody. Not everyone has accessed it, but a lot more people have accessed it. And there's a lot more even simple platforms on, you know, what they call dumb phones, you know, simple, cheap phones. There's a lot more of that available than there would have been without the pandemic. Using hotels for as delivery rooms because they're empty, right? There's no tourists. So this and for protection against domestic violence. These are innovations, you know, that is cheaper than waiting until the problem gets really large. And also repurposing pharmacies, you know, pharmacists and health workers are among the most trusted that, in this whole pandemic. Technology that works for women though, that, you know, that actually helps them with things like moving around, like culturally, whether they can move around or not is an issue in some regions. As well as in a sort of macro sense. And ultimately this idea of It's a behavioural focus. And we have more than just lockdown available to us. And that is really the risk, that we might be using only lockdown as our major tool. All the other tools are actually in the hands of the community. And this is where women really do thrive. And not to forget that, of course, whatever is good for gender equality is actually good for the economy and society. So just the last slide to just bring together a few more of those ideas. We need cash in the hands of women now. If we wait, digging out is going to be a lot harder. It's digital and financial inclusion, again now, not later. Having support for the work of women, the informal workers, like we know this. And this is McKinsey and others saying it, that we need to address it now, not dig out of it later, in order for it to be somewhat manageable. The caring industry, the unpaid labour needs to be addressed, and that is about that support, of course. I talked about education, continuity of health services, because otherwise there is a risk that the impact of some of these so-called public health measures could be larger than the saving on the COVID protection. So the impact of being at home, the domestic violence or underlying health issues could be worse than actually what COVID may have created. And just ultimately that it's local partnerships, that's where women are. It's civil society organisations where they know how to be innovative, and it's responding using really good local data so that you know what the issues are in the community, and allowing communities themselves to come up with the solutions. We're definitely at that stage now where we manage the risk, wear the mask, wash the hands, etc. But communities, we know from Ebola and other experiences, communities will manage their own risk. They understand it's in their own interests. And we all know women are good organisers. So I'll stop there in the interest of time, Claudia.
Yes, thank you very much for giving us this breadth of solutions or strategies that may work better for certain groups like women and girls and other vulnerable groups. And we have some questions more related also with, for example, GBV. So we talk about the lockdowns as not being the only strategy, and there are strategies that are in the hands of the community, that we have more agency, that can be more bottom-up and less top-down. And we know already that the gender-based violence has been rising as a result of the lockdowns. And it seems that in some countries, lockdowns will continue. So what are your suggestions of what can be done at this point just to try to avoid the second epidemic of the GBV?
Yeah, so it's in a micro sense and a macro sense. What we would do for around GBV will be of benefit to the whole response. So what we need to do is get into local communities and look at how do we manage that locally. Where is the local solution? People cannot travel to, say, a safe house in the case of GBV. There needs to be something local. And so literally this example of hotels, I don't mean like necessarily big global chains of hotels. This is happening in smaller ways as well. And communities taking in women and children who are at risk on a local scale. So I think that this idea of localizing, one of the challenges is we really need a system, right? A system is something that happens in a predictable way, and it has components that are set up for that purpose and they work. We have a patchwork of civil society, NGOs and government functions in society that is not a system at local level. So for example, if we could have a network of civil society organisations, NGOs, etc., working with local governments, etc., that is sort of registered and coordinated, so that we're working to one plan, where we know who's providing the food, who's taking care of schools, who's looking at this, who's looking at that, with a coordinated plan. Then we have a chance of something operating like a system at community level. joint agreements between communities, like leaders, you know, organizing themselves, a leader making a commitment with the discussion with the community, feeding back information, working with local government, for example. It's, you know, it's a somewhat formal commitment. I'm not necessarily suggesting create formal structures that slow things down and bureaucracy, but to have a sense of a discussion, having access to the same information as the decision makers and being part of, you know, the decision-making process to create, that's what I mean by a system. And that's the next wave that we haven't mastered yet. Very few countries are able to say they can draw down on civil society organisations, NGOs, etc., when they need to on these different issues. And these are things best done before there's a panic, before it's urgent. Hard to do when you're in the middle of it, but at the same time, sometimes there's some opportunity there.
Thank you. And that leads us to our last question from the audience. So the impact of COVID on women and girls is immense. For example, in India, as in other parts of the world, gender rights have rolled back tremendously. And so globally, what strategies need to be the core focus to get back on track? So what can we do at this point?
Yeah, and that's come up in different ways. And I guess this is why I made the point about lockdown. When we look around the world, governments seem to be, no, I don't want to sound overly critical, but they seem to be using lockdown as their main tool. Lockdown should be the last resort. Nobody in public health wants to be responsible for that. It's difficult. It creates all these other problems. It's very, very hard to do. And it has an impact, yes, but it, as I said before, may cause secondary impacts that are even more difficult for us to manage, particularly in low-income environments, like not being able to work means not being able to eat. The shift needs to come around behavioural, really a focus on the behaviours that communities themselves come up with, the conditions and, you know, changing policies within their local community, even at a neighbourhood level, not even, you know, even smaller than a council level. We saw, for example, in West Africa during Ebola, communities managed managed people coming in and out of their own towns, villages, streets. Young people in particular would man kind of, you know, informal roadblocks where they just stop the car and say, hi, what are you doing? Where are you going? Or if you're walking past, you know, oh, are you from here? Not from here. In small communities, they know if you're from here or not. But that was done in capital cities like Freetown, as well as villages. So this is this idea of agency, but it needs to be part of the system, part of the strategy. We're not talking about people taking, you know, the things into their own hands, but there's the policy side, right, of, you know, what are the policies we want in our community that we think will help. We need to move around to work, to earn money, to get food, etc., take care of children, take care of healthcare. How can we do that in the best possible way in our community? It's different in different places, and it is possible to do it. It is possible to do it as long as you manage the risks. So that ownership at local level and that systems approach, that's the piece that's the next frontier for us in community engagement and behaviour change. It's not just about individuals deciding. Your environment actually decides for you. And that's where we need to really go with this.
Thank you very much, Amaya. So we arrive at the end of this conversation. Thank you for all these amazing, wonderful insights. And it's good also to finalize in this more positive note of empowerment and agency. So we answered the questions from the audience. So I would also like to thank for all the questions that you posed in the Q&A chat, and also to Vitya and to Pascal for organizing this conversation. So this is going to be the last conversation that we have in this series of the Conversations in the Global South. So we'll have a new seminar series starting in November. So please check our social media, LinkedIn and Twitter, and our website for our coming seminars. And we have our address there. And please stay connected. And thank you very much, Amaya, again, for answering all these questions and for this wonderful presentation. Thank you very much.
Thank you for the invitation. Bye, everybody.